Alright, so this is the kit for a surgical chest tube. So you'll need the chest tube itself. The kit comes with some lidocaine. You'll need to have more lidocaine, 1% at bedside. Comes with some drapes and then the big drape here. And you'll need to get more ChloraPrep for yourself. In here we have all of our equipment. So first you'll prep your chest tube. So usually you'll cut right here. So you'd actually cut this with scissors right at kind of this bulging point here. After you cut that off with scissors, just clamp the end of it shut, and then you will load your chest tube like so. So if we're prepping the patient, you're going to go mid-axillary line, 4th or 5th intercostal space over the rib. You'll drape them, fold, and do the top and bottom first, fold, fold there. Then you take your drape. I'm not actually going to do it, but this would go on top. Then you're going to identify your landmarks, anesthetize. So draw up your lidocaine. And this would have already all been prepped with iodine or ChloraPrep ahead of time, and then draped. So to anesthetize, make a wheel first, then go straight in, aspirating, going above the rib, aspirate until you get to the pleura, there's a bubble, and inject lidocaine all along the pleura, and then inject all along the above the rib as well. Now you're going to use your scalpel make an incision. So pretty wide. Then use your clamps to dilate all the way down. You can also use your finger as well to help dilate. And once you're right above the rib, you're gonna poke through. You should feel a rush of air. Open and pull out with it open, and put your finger in to hold the tract, Get your tube, which is already loaded, and then once you have your tube in your track, you can take off the clamp and feed your tube all the way through. After that, you can connect it. You're going to have a Pluravac set up, and you're going to connect this to the Pluravac. So this will be cut in real life, and you will connect this and tape around the edges. And then to suture it in place, you'll put a suture simple interrupted above, and then do the sandal technique and wrap around and wrap around, wrap around, and then tie a bunch of knots. And then if there's a big incision, you can do a simple interrupted below, wrap around with leaving the tails long, wrapping around the tube, and tie a knot. And then you put fluffs on either side and Tegaderm on top.